We go into a study of the respiratory system, and you know the organization of the respiratory system, the structures involved, and the exchange of gases, the tubings that result in air getting to the lungs and then evacuated from the lungs are responsible for ventilation. The respiration happens where there's gas exchange at the acini or the alveolar sacs, and how infection or obstruction can negatively impact respiration is what we are going to study in this class of pathology of injury and illness. You know that neck and above, upper respiratory, very often illnesses begin here and then can be communicated down into the lower respiratory tract. And so the authors of your textbook really differentiate between diseases that are upper respiratory, lower respiratory, and then at the locality of gas exchange in the alveoli. So the supplying of oxygen, the oxygenation of the blood for dissemination through the cardiovascular system, and then also the elimination of deoxygenated blood or giving up of carbon dioxide is important to us. Certainly the PowerPoint presentation is available to you. I really recommend having that available to yourself while you watch this video and do your other studies. I think this is an attempt to emphasize what might be valuable to you along the way as we move into critical thinking. And so, as we said, and as you know, the gas exchange occurs at the alveoli, where oxygen is extracted and provided to the arterial bloodstream. That goes back to the heart and then is circulated. Deoxygenated blood comes in, and then oxygenated blood flows out of the lungs. And then I'm not sure that you've had exposure to this, but as a result of anomalies, people genetically predetermined to have challenges in the potential space of the thoracic cavity that can influence lung and heart function. One anomalous posture is pectus excavatum, or funnel chest, where there's depression of the sternum. You can imagine that that puts a restriction on those organs in the thorax. And then also being aware that a very prominent, it could be a very thick sternum that is convex both anteriorly and posteriorly can affect the function of lungs or the filling capacity. People who have chronic respiratory difficulty, where they're retaining a great deal of air in their lungs, very often as a result of emphysema, which we'll talk about in a minute, can have an acquired change in chest dimensions. This is called barrel chest. This is a cadaver specimen. This person had tremendous respiratory pathology, and they acquired this massive chest because there was more air in their lungs than is typical, and it changed their posture. And then you're familiar with scoliotic changes. This is genetically predetermined that a person would have a curvature, and this can, they don't tend to live to old age because there's great pressure on heart and lungs. So that's why a reconstructive surgery to minimize or reduce the scoliosis is advisable for quality of life and also for longevity. And then there are conditions where hypercurvature of the spine. This is the woman who had this extreme kyphosis, and she had a surgical correction where her spine was put into a more extended position. Can't get back to 100%. They shoot for 50%. And likewise, in another set of circumstances where these generations of females in the family over time had compression fractures of the anterior centrums, and you can imagine that that reduces the size of the thoracic cavity. I think you're familiar with most of these signs and symptoms of pulmonary disease. We will make differentiation between types of cough, productive and unproductive coughing. In certain kinds of infections, particularly bacterial infections, coughing tends to be productive in that secretions are eliminated from the lungs through coughing. In aspirational threats to the lung, where we've gotten something into the lung, coughing is the self-protective mechanism to try to expel that foreign substance from the lungs. Dyspnea is difficulty breathing, sometimes painful. Lots of sputum. It could be that a person has chest pain because of buildup of fluid in the lungs. And then hemoptysis is blood-tinged sputum that could indicate neoplastic changes or chronic bronchitis, and there's just such irritation that there's some hemorrhage that occurs. That's an indication, or a sequel to that is that because there is a severe inflammatory condition that leads to hemoptysis, this is a person who's vulnerable to bronchiectasia, which is scarring in the lungs. And then cyanosis, you're familiar, if there's not good oxygen saturation, the person is low on oxygenated blood, typically around the mucous membranes, the beds of the nails. The person could be bluish. And then we've talked about clubbing of nails, and we'll spend some time in lab on altered breathing patterns. Clubbing of nails, you see this, altered breathing patterns, very often associated with trauma to the head or infections or collapsing of lungs. So we head into our study of respiratory pathology. We begin in a section on infections of the lungs. The first and quite a challenge worldwide in terms of healthy lung function is influenza. Now, there was a period of time in my life when I thought influenza was what we now call gastrointestinal flu, vomiting, diarrhea, so forth. But really what should be elicited in your mind when the expression flu, it's respiratory, and it's a viral cause, and depending upon what the Center for Disease Control and World Health Organization try to predict what kind of flu is emerging, and then the serum for the flu vaccines every year. This is a disease of winter, and so getting flu shot for people who have respiratory threats or vulnerable to if they're immunocompromised, all of those people should have flu shots. And people who are in their 50s and above certainly need to have flu shot. And listed for you are the symptoms of the flu. That includes muscle pain, fever, fatigue, cough, and you know that there's not a medication that will heal that once you have it. The vaccination is to try to bolster your immune system to throw it off when you're exposed to it. But the treatment is treatment of symptoms once a person has it. And so the time for immunizations is October and November. And then upper respiratory infections, as I indicated to you, very often the illnesses that become lower respiratory infection begin in the upper respiratory tract and then migrate through, the virus getting down into the lower tubing of the lungs. And so the symptoms include what's listed here in terms of inflammations of the larynx and the throat, headache, and very often rhinitis, inflammation of the nose, and runny nose as a result. And the prognosis is that it can lead to infection in the ears, asthma, chronic obstructive pulmonary disease. And so this can lead to other things. Remember the neck check in terms of dealing with active people. If symptoms are above the neck, then take a little bit more liberty. If symptoms are in lower respiratory, then they need to be guarded. And then we move to what can be a very devastating disease. It's hard to get. You have to be exposed to the tuberculin bacteria over a considerable amount of time, and this is spread through what are called droplet nuclei. And so please be very familiar with this. There's been an uptick of tuberculosis in the U.S. It's rampant in third world, and it's very devastating. It causes caseations in the lungs, the skeleton, and the liver, possibly. And how much of your liver can you live without? How much of your lungs can you lose and still maintain life? This is a tough disease to get. It's preventable, and as you study tuberculosis, you know that you can be exposed to it and not have symptoms, and then it goes into a dormant phase, and then it can come back, 5 or 10 years later in full force and cause these caseations. We're in the respiratory system. This happens in the lungs, and holes develop in the lungs. The term caseation refers to a Swiss cheese-like effect in the lungs, and there's a loss of alveoli, and lungs can be lost. So here in your PowerPoint is a post-mortem cross-section of the lungs that shows the caseations. This is an X-ray of a tuberculin lung where you see consolidations. This is a very sick person. They've lost a considerable amount of their lung that's filled up with fluid, and it's inflamed, and scarring happens along with the caseations. People who live in confined space, people in prisons, in institutions where they're in close proximity, in preschools, are vulnerable to this. And I indicated to you that this can occur in skeleton, liver, and lungs. So, okay, bless you.